agree on a way forward. Vaccine inequity is a solvable problem. We call on manufacturers to prioritize COVAX and AVAT. We call on countries that have already achieved high coverage levels to swap their near-term vaccine deliveries with COVAX and AVAT, to fulfill their dose-sharing pledges immediately, and to facilitate the sharing of technology, know-how, and intellectual property to support regional vaccine manufacturing. We call on all countries and manufacturers to share information on bilateral deals with COVAX and AVAT so we understand where vaccines are needed most, and to share information on supply and delivery projections so countries can be ready to immediately roll out vaccines when they land. And we call on all countries to recognize all vaccines with WHO emergency use listing. I may sound like a broken record. I don't care. I will continue to call for vaccine equity until we get it. But you don't just have to hear it from me. Today, I'm honored to be joined by several leading voices to talk about how COVAX and AVAT are working together to achieve our shared vaccination targets in Africa. First, I'm very pleased to welcome Mr. Strive Masiyiwa, the African Union Special Envoy for COVID-19. Strive, thank you for joining us and for everything you're doing with AVAT to deliver vaccines to Africa's people as soon as possible. Thank you for your leadership, and you have the floor.
Microphone for the speaker, please.
Over the last 2 days, we have had 2 days of very intense discussions with our colleagues at WHO, Gavi, WTO, CEPI, to really review some of our work together. Just to recap, the African nations, under the leadership of President Ramaphosa and the executive committee of known as the Bureau of Presidents, created AVAT because our target was 60%. And the donors had kindly offered to provide up to 50% of our target through the initiative called COVAX. So we were created and mandated to be a 50% partner of COVAX. And we work closely together. We talk regularly, we exchange information, but we felt that the time had come for us to meet, even in these difficult times of travel, to meet and to really explore with our partners under the leadership of the Director General. And leadership it has been. I'm joined by my colleagues that we will share remarks together around key issues, but hopefully we will also be able to give clarifications around the deliveries. But just to recap, our population is 1.3 billion people. So our target of 60% of our population is just under 800 million. The African Union treats the Caribbean member states as the 6th region of the African diaspora. And because the CARICOM member states appealed to the African Union to say we are unable to buy vaccines by ourselves because we are treated as too small, could we work together with you? So we treat our delivery target as vaccinating 800 million people for Africa and the Caribbean. And so we created a pooled mechanism for aggregating our demand from the member states. We've so far, with all the difficulties that have been well articulated, managed to secure for the next 12 months 400 million single-shot doses from the American company Johnson & Johnson. And we continue to negotiate with other suppliers. But as you will see, when we receive the 400 million, that would go a significant way towards our stated target of 60%. But there have been major difficulties in ensuring that supplies that are supposed to come through the COVAX facility come through. So we've worked together to try and identify the challenges, and we came also to offer whatever little help we can to see how we can open up these deliveries, speed up these deliveries. But it does require very much that there be a global effort, because COVAX is only as strong as those who made commitments to support COVAX. It's only as strong as those who made commitments to pledge to share their doses. It only works as well as the manufacturers recognizing that they also have a responsibility in equitable distribution. Production is limited, yes. That means we all must act responsibly when it comes to how vaccines are sold and bought. So I will stop there for now. Mr. Director General, once again, thank you for your time and attention to the African continent.
Thank you, Strive, and thank you again for your leadership. It's now my great pleasure to welcome Dr. John Kengasong, the Director of the Africa Centers for Disease Control and Prevention. John, thank you for your leadership in fighting the COVID-19 pandemic in Africa without the tools that so many other countries have access to. You have the floor, John.
Thank you, Director General Dr. Tedros. And let me just pick up from where our AU Special Envoy, Mr. Strive Masiwa, ended. I mean, he indicated that as a continent, we had endorsed a target of immunizing up to 60% of our population. I think a good starting place for all of us would be to understand where we are. As we speak today as a continent of 1.3 billion people, we have just under 3.5% of our population, eligible population, that has been fully vaccinated. And I'll repeat that number, 3.5% of our population that has been fully immunized. At the same time, we have celebrated the remarkable success that was made by the scientific community in producing several vaccines. And at that time, at the start of this pandemic, we always agreed that the way forward for all of us will be global solidarity and global cooperation and the power of partnership. Today, we are here to manifest that power of partnership, global cooperation and solidarity, that we will not be able to achieve 60% of our population fully immunized if we do not fully explore and deploy the power of partnership, the power of cooperation, and the power of solidarity. We all have acknowledged now that vaccines are the only solution for us to get out of this pandemic collectively. And that has to be done quickly. I've always stated that the quickest way to get out of this pandemic is to vaccinate quickly. As a continent, we believe and we adhere to the 70% target that Dr. Tedros just mentioned, and we'll be working together with COVAX and other partners to make sure that the continent gets that 70% of its stated target. I thank you, Dr. Tedros, for the opportunity to continue to work with the WHO and work with Gavi and COVAX and other partners. Thank you.
Thank you, John, and thank you for your continued partnership, including through the mRNA Technology Transfer Hub that we have established together in South Africa. And next, it's my pleasure to welcome Dr. Vera Songwe, the United Nations Under-Secretary General and Executive Secretary of the Economic Commission for Africa. Vera, thank you so much for your leadership and thank you for joining us today, and you have the floor.
Thank you. Thank you very much, Director General, Dr. Tedros. And it's a pleasure to be in one of our buildings with you again and with the team. My responsibility and role in AVAD is really to look at the economic perspective of the continent. Before we had the COVID crisis, of course, Africa was seeking to create more jobs, 13 million more jobs we needed to get to prosperity and meet, of course, the SDG goals. The COVID-19 crisis has stopped all of that in its tracks. And just to give you a sense of what that really means, every 1 month of lockdowns on the continent cost us $29 billion of production that was lost. So for us, when we say that COVID-19 is an economic issue and we need to respond to it to be able to recover and reset our economies, it is real. And I think for that, we need financing. And we need to see how we can bring together global financial structures to ensure that we can actually respond to this crisis. And that is what I think Professor Orama will be talking about. But beyond that, we also have the special drawing rights that have been released, and Africa got $33.6 billion of special drawing rights. We are now, and we thank the World Bank in particular and the IMF for providing financing up until now, but we hope that we can get the international community to continue to on-lend special drawing rights so that we can create a vaccines facility to be able to respond to what is now seemingly going to be a continuous spend for the continent. The continent has worked really hard to ensure that its macroeconomic balances were solid. Some countries were reaching debt distress levels. COVAX, the COVID-19 virus is clearly going to throw them across the board. So we need some funding for vaccines, which is concessional and long-term, if possible, at best, to make sure that countries can respond to COVID-19, but not compromise economic growth and prosperity. So again, I think we just want to thank you, Dr. Tedros, for continuing the fight for vaccine equity, but also to ensure that there is better transparency in the availability of vaccines, because we know that scarcity means increased cost, and we cannot afford today as a continent that kind of scarcity. And then finally, the African Continental Free Trade Area Agreement provides us with the recovery and the reset structure and framework for that. That means we need to manufacture vaccines on the continent, and we hope that we can come together working again with WHO, but COVAX, CEPI, UNICEF, to ensure that pool procurement mechanisms allow for Africa not just to produce, but also to sell, and not only to Africa, but to the rest of the world, the vaccines that it produces. Thank you.
Thank you, Vera, and thank you once again for your leadership. I'm now pleased to introduce Professor Benedict Orama, the President and Chairman of the Board of Directors of Afreximbank. Benedict, thank you for joining us today, and thank you for your support for expanding access to vaccines in Africa, and thank you for your leadership. You have the floor.
Thank you very much, Director General, Dr. Tedros. It is a pleasure to be here, and we thank you for the hospitality and the warm reception from you and your colleagues, and also from SET, from the Gavi COVAX facility. I will continue from where my colleague stopped. The creation of the Africa Vaccine Acquisition Task Team was a direct manifestation of the continent's determination to take its destiny in its own hands towards tackling the problem of the COVID-19 pandemic. Africa did not want to once again be at the bottom of the queue with regard to vaccines, because it was well known to everybody that economic recovery meant bringing the virus under control, the pandemic under control. And vaccines are seen as the only credible instrument to do that. So the mandate of the given to the bank as a member of the AVAT was to, as financial advisors, to help structure a financing mechanism and provide structures that will make it possible for the continent to procure vaccines on a whole of Africa approach. We did not want, our leaders did not want our countries to be competing amongst ourselves. They also did not want our countries to be before manufacturers who were only interested in talking to countries that that could only provide cash before delivery. So we were able as a team under the AVAT to structure instruments that we believe will now be legacies that will support the healthcare infrastructure for the continent. We had to create a trust, the Africa Vaccine Acquisition Trust, as a vehicle for the pooled procurement that we wanted to make. Because the African Union itself could not borrow under this mechanism. We had to do that because realizing that the COVAX facility promised to provide 30% of the vaccines we needed, we knew we had to find vaccines for the balance of the 30% to achieve the 60% target. On top of the trust which we used, we also created a continent-wide no-fault compensation scheme, which with the support of the WHO, we've been able to put in place at record time, so that everybody who receives vaccines under the AVAT facility will be protected. They can use the facility to deal with any complaints that they may have. And we've done this, making sure we use the same administrator as the COVAX no-fault compensation scheme to avoid confusion. And this underpins the kind of collaboration we are building with COVAX going forward. With the Delta variant and with the revision in the vaccination coverage that WHO announced, that is 70%, we will now be going back to our leaders to also raise the coverage to 70%, as Dr. Nkegason mentioned. That will require another $300 million of financing to make sure we are able to cover the requirement. It is important that we do this for the simple reason that our countries want us to make sure that we do not fail and therefore put our economies in difficulties, make it difficult for us to recover quickly. We thank you and thank the COVAX, for all the support, the work we've done together. And we look forward to continue to work with you as we deal with this and then transition to supporting the creation of manufacturing capacities on the continent. Thank you very much.
Yeah, excellent, Tim. I think I can see the division of labor. And all that you have said is complementary to each other and also your own areas of contribution. So very, very proud. And thank you so much also, Benedict. And next, I'm pleased to welcome my friend, Dr. Seth Berkley, the CEO of Gavi. Seth, thank you for your leadership and partnership, and you have the floor.
Thank you, Dr. Tedros, and esteemed colleagues, friends in the media. I appreciate the opportunity to be with all of you today. I am the last speaker, so I want to leave as much time for questions, so I'll be brief, but I want to make two sets of comments, first on COVAX and then on the importance of this meeting today. On the COVAX side, I think we all know that the global response has not been good enough. The inequities that we've heard about over and over continue. COVAX was set up a year before, at a time when we didn't even know if any of the vaccines would work, to assure that all countries in the world contain access to a successful and efficacious vaccine. With the backing of 190 countries, we wasted no time in trying to raise money, over $10 billion at the latest count, to secure doses and to create the largest portfolio of products. We now have 19. This is the largest portfolio in the world. Now, much has been reported about, and Tedros reviews the challenges we faced, including things like the speed at which doses were snapped up early before there was money to buy for developing countries, export bans that limited our access to vaccines, the delays that were provided by certain manufacturers. But I think it's important to look forward, and today we're poised to embark on the busiest period of what is the largest and most complex vaccine rollout in history. You already heard some numbers. Today, 270 million doses have been delivered through this mechanism. 70 million of these have come in the last month, and we're seeing deliveries accelerate further. In total this year, we expect to have a total of 1.4 billion doses available for delivery. This is enough to protect 20% of the population in the 91 lower-income economies eligible for doses in the advanced market commitment. By March, this number will rise to 2.6 billion, which is enough to protect 37% of the population in these countries. So I think we've demonstrated that COVAX can work at scale, but it's really time for the world to get behind it. That's why last week we called on governments to recommit with further action. Join us in telling manufacturers to make the supply schedules transparent so we know where COVAX and its participants are being prioritized. For countries to give up their place in manufacturers' queues if they've already achieved high levels of coverage and don't need vaccines at that point. And to expand, accelerate, and systematize dose donations so we can put excess doses to good use. Now, let me move to this meeting, which has been so important. It symbolizes the spirit of partnership between COVAX, the African Union, and AVAT. Africa needs more doses, and together we will get them. The African CDC, under the leadership of John Ngengasong, had set a goal of 60% of the population. We've heard that that goal may change. They've asked us to provide half of those, 30%. We expect to meet that goal in February of 2022, and if the goal is increased to 70%, we believe we can meet that goal by March of 2022. We look forward to working closely with the AU's regional mechanism, AVAT, to get the supply of the vaccines we need and to overcome the problems that stand in our way and to assure the most difficult challenge, which is continue to build the systems to get these vaccines into people's arms. We really also want to salute the leadership of AVAT and AU for creating such strong regional leadership in this area. This is critical to solve the issue now, but is also critical to prepare for the future. And these were topics that we discussed on how we can all support that going forward. So thank you very much, Dr. Tedros. Back to you.
Thank you. Thank you so much, Seth, and thanks again for everything you and your colleagues have done and continue to do to make sure everyone benefits from the power of vaccines. Last but not least, I'm delighted to welcome my colleague, Dr. Shidi Moeti, WHO's Regional Director for Africa. Shidi, you have the floor.
Thank you very much, Dr. Tedros. It's a great pleasure to join you, join all of our partners, and I very much appreciated our discussions earlier on, and to join our journalist colleagues for this press conference. Much has already been said about the challenges in global vaccine supplies. So I will go to the question, which is very often asked: do African countries have the capacity to absorb the vaccines when they get them? My colleagues and I believe the answer is yes, although, as Seth said, we are working very hard to make sure that their preparedness is up to speed. The continuous challenges is that global supplies are just not being shared in ways that will get all of us in the world out of this pandemic in time. African countries are standing by to hugely ramp up their rollouts, having learned a lot from the delivery of the first vaccines that they received. Quite a few of them have done detailed analysis of what went well, what gaps were identified, and are working very hard to fill them. As WHO in the region, we've worked with them to develop revised, detailed local plans to mobilize the delivery capacity needed. Intense work is going on to put the right storage capacity in place, including cold chain, to adopt delivery strategies to handle the multiple vaccines that countries are receiving, to use technology for registration and tracking systems, to mobilize and prepare enough vaccinators, most importantly, to mobilize the people and address hesitancy and misinformation. Hundreds of WHO staff are on the ground, backed up by our team in the regional office and headquarters and working within the COVAX partnership, ready to support countries to expand vaccination sites and to manage all the complexities of such a big operation. What's more, I'd like to say that African countries have done this before, although perhaps not quite to this scale, successfully implementing huge vaccination campaigns against polio, yellow fever, and cholera. Of the doses already received, 3/4 have already been administered, and some countries are repeatedly now indicating they're hitting barriers simply of limited supplies. So I'd like to join the appeal to pharmaceutical companies and to countries that have vaccinated their high-risk populations, and also to the citizens of those countries to add their voice, to share vaccines with African countries urgently, to release reserved vaccine supplies for AVAT and COVAX to purchase, so that we work together to protect the most at-risk groups everywhere, and we can end this pandemic together. Again, I'd like to say I look forward very much to working with John, with Vera, with Strive and our partners at the African Union, and within the COVAX mechanism to support our countries. Thank you.
Thank you, Sidi. Before we take questions, this Friday is World Patient Safety Day. Our theme this year is Safe Maternal and Newborn Care. Childbirth should be a time of celebration for families and communities. But for too many, it's a time of sorrow and grief. Every day, nearly 5,000...
All right, there's the focus then on Africa and the COVID-19 vaccine equity being discussed currently in Geneva by the WHO and the panel there, a specific focus then on Africa.